It seems that America is entering a new phase of the pandemic as it faces a post-vaccination world. A recent opinion piece in the Washington Post takes a closer look at the gradual shift taking place from Americans having to follow certain health and safety protocols to choosing to follow those guidelines. Joseph Allen is the author behind that article. He's also an associate professor at the Harvard T.H. Chan School of Public Health, as well as the director of the school's Healthy Buildings program. Thanks so much for being with us.
Yeah, thanks for having me. So,
Joseph, I guess the problem is, or the issue is, there have been in just recent weeks, guidance from the CDC, and then you have guidance from doctors, or even Dr. Anthony Fauci himself, that sometimes contradicts itself or contradicts what people are actually experiencing and seeing. So let's talk about kids and masks specifically. The current CDC guidelines recommend children over the age of 2 wear a mask in public. That's inside and outside because they are not vaccinated. You disagree with that. Explain why you think kids should not wear masks at all.
Well, I think this is, first, let's acknowledge it's a confusing time for everybody, and that's because the vaccines have really given us a lot of hope, and as such, our guidance needs to be changing accordingly. So these vaccines are safe, they're highly effective, and they're what's responsible for driving down risk for all of us and even allowing us to have this conversation about changing controls. Let's be really clear, masks work. But what's changing is that the risk to everybody is dropping thanks to the vaccines. So in terms of kids, here's how I think about it. First, let's take outdoors versus indoors. Outdoors, I don't think anybody needs to wear a mask right now because the risks outdoors are extraordinarily low. We actually don't see spread happening outdoors, and that's because you get unlimited dilution. And so mask wearing outdoors is really not necessary. For kids, I do recommend they wear masks now through the end of this school year, but starting next school year, I don't think they should need to be wearing masks indoors because the risks will be driven down low, and every adult at that point who wants a vaccine will have had access to it, and same with kids over 12 at this point, thanks to the new authorization by CDC.
I'm glad you brought up the thing about outside because, and I hate to say this because obviously I do this every single day and we're always covering what the CDC guidelines are, but when they came out with the guidelines about you don't have to wear a mask outside unless you're in close contact, and they were sort of revised guidelines, I remember thinking, that's a revision? I thought that was what we had been doing this whole time. And it did seem sort of confusing, and it did seem like, well, what's the change now? And I guess you agree that, yeah, you don't need these masks, not if you're distant from people and you're outside.
Yeah, I think that's right. I think CDC actually didn't go far enough, and I think that's some of the confusion here. But the reality is, like I said, well, first, if you're vaccinated, your risks are low indoors or outdoors, and you could start pulling back on controls when you're in private spaces. It gets a little trickier in these public spaces indoors, and we can talk about that in a minute. But outdoors, yeah, what's different is that you really don't need to wear a mask outdoors right now. Now, does it make sense if you're unvaccinated and you're going to be very close to someone? Yeah, you might want to wear masks or keep that extra distance. If you're vaccinated, not going to be a problem either way. But I tell you, even when people are not fully distanced outdoors, because you have so much air movement and plenty of space, and the interactions are transient, meaning they're short, the risks are low, even outdoors, even for people who are unvaccinated. But look, I also want to say this. If someone wants to wear a mask outdoors, that's great, and they're welcome to do it, and they should do that free of harassment. We have to recognize this has been a traumatic year for everybody, and people are going to come out of this pandemic in the U.S. at different speeds and different paces with different levels of comfort. So I think we need to be considerate to our fellow citizens here, and if people want to wear masks, that's perfectly fine.
Yeah, two things that I thought. One, with regards to masks, and I think we had Dr. Fauci on CBS this morning earlier, Professor, and my colleague Gail King asked about masks and said that when she was out walking about in the streets of New York, she had on a mask, and she noticed that everybody in New York City had on masks too, even though New York City is doing very well in terms of vaccinations. One thing that I thought of is, you can be safe without wearing a mask outdoors, but almost every single building and every single business and taxi cabs and Ubers require you to wear a mask. The constant taking it off and putting it on and stuffing it in your pocket, sometimes you lose it because you put it down somewhere and you don't remember where it is, which you're actually not supposed to do, as you as doctors and everybody advised us in early days. But I mean, that whole thing, right, where you're taking it off and putting it in your pocket so that you can walk around outside. Then when you get into a store, you put it back on again. You're touching it. I think that, it's just maybe for some people, I know for me, it's just easier. If I know I'm going to the supermarket and it's a 5-minute walk, I'll just walk with it on because after a year and a half, I'm sort of used to it. And your other point about how we've all gone through this over the last year and a half, I don't know. I remember when I covered the earthquake in Haiti, and I was there for like almost a month and a half. And when I came back to New York, I would say for almost a year, every time a subway would rumble, I would sort of stop and freeze because I just had this notion of aftershocks that we would always run to like find safe shelter. And I suspect that the brain works the same way with a pandemic, even though it's not perhaps as physical as a subway rumbling or an aftershock of an earthquake.
Yeah, this is what I mean. Our collective psyche has changed. Even people who don't think it's changed all of us and in different ways. So we do need to be kind to others, like your experience, that people are experiencing this pandemic very differently. Some people might have lost a close relative. Others may be out of work. Their sense of risk is different. So it's perfectly okay to wear a mask. And I don't like the mask shaming or the unmasked shaming that's happening. I also think, right, as you said, when I go outside, I keep the mask with me. In case I go indoors somewhere where there still require masks, that's a good idea. And also, I actually still put it up when I see someone coming at me outdoors who has a mask on. It's a courtesy. It's really not a big deal to wear a mask, as you say, and it's a sign of respect to someone else. I don't know what that person who's walking towards me, how they're feeling, so I put it up. It's really not a big deal. I do think in the coming weeks and months, this will start to shift as we really continue to see cases, hospitalizations, and deaths decrease thanks to the safe and effective vaccines that we have. And then people will feel more comfortable, I think, being maskless outdoors. And I propose in that article that after July 4th, there shouldn't be top-down mandates for masking indoors even. And some organizations will continue to have those indoor mask mandates, but really it won't be a top-down mask mandate anymore as community spread decreases and our collective risk decreases. That said, again, individuals should be free to wear a mask indoors if they want to. Some organizations could still require it, and that's totally fine. But the main point I make in the article is that we're changing from a top-down government mandate approach to we had to have these controls in place for the past year to prevent healthcare collapse. We're moving to a new phase of the pandemic where really the burden or decision-making shifts to individuals and individual companies based on their own risk tolerance or level of comfort.
Professor Joseph Allen, I think you really tapped into kind of the private conversations that a lot of people are having in your op-ed. So I thought it was great. And I think, yeah, it depends on your location, depends on your community. I do the same thing as you. I always have the mask kind of hanging underneath my chin. If I'm passing somebody on the street, I'll put it up because I live in a community where everyone wears their masks. And it is more of a courtesy than anything else. I know the chances of an infection, especially for me because I'm vaccinated, pretty minimal. But it's the basic thing you can do to be sort of neighborly, if you will.
Anne-Marie, you don't mind the mask pulling down your ears when you're walking with it around your chin? I hate that feeling.
I don't know. It may have something to do with the distance between my two ears, but I don't get a lot of pull. I don't get a lot of friction there, Vlad.
Okay. I guess
so no, it doesn't bother me.
Get one of those things that like those pincers that checks my head.
No, you have a normal size head. In the spirit of what the professor says, to each his own. And so for you, it's better just to wear it the whole time because it's irritating to have it just hanging underneath your chin. So anyways, as we go off on a tangent, Professor, and you have to witness this, thank you very much, Professor Joseph Allen. Appreciate your time.
Like to have a little fun. Thanks, Professor.
Thanks for having me on.